Over to you.
Thank you.
We are live now.
Good afternoon to all of you. Namaste. Welcome to the launch of Amrit Grand Challenge जनCARE program. My name is Sonia Gandhi and I am working as Chief Manager for the investment group with BIRAC. The Amrit Grand Challenge is an effort towards strengthening the National Digital Health Mission of Government of India and is envisioned to develop 75 digital health tech innovations in the area of telemedicine, digital health, and health. So to start this ceremony, I would like to invite Dr. Alka Sharma, MD BIRAC, to give her opening remarks. Over to you, ma'am.
Thank you, Sonia, and I'm so happy to see all of you here. And good afternoon, everyone. And today I'm happy to be a part of this Startup India Innovation Week, which is being organized by DPIIT, and DPIIT has given this slot to BIRAC and the PSU of DBT, and we all are here for the cause that today we know that 16 January has also been declared by our Honorable Prime Minister as National Startup Day. And today we are meeting for this Amrit Grand Challenge launch. So as you know, the Department of Biotechnology has major thrust on promotion and support for public-private partnership. And as you all are aware that it's long back, more than a decade, almost BIRAC was established. And BIRAC is facilitating and supporting a lot of programs and schemes to promote and support public-private partnership across the country. And just to recap a few of them, more than 5,000 startups, biotech startups already established in the country, and also 60 bioincubators in 18 states have been established. So now there are various schemes on the BIRAC that on the domain-specific areas, agriculture, medtech, and medical biotechnology, and also they have a national mission program that is being implemented by BIRAC, National Biopharma Mission, Grand Challenges India, in India-centric CEPI program, and also very recently to combat COVID-19 pandemic, Mission COVID Suraksha. They are implementing these programs in a big way. So in order to nurture scientific innovation in various domain-specific areas, a number of schemes have been launched by our BIRAC, and they are playing a major role in a to combat current pandemic. And now the kind of diagnostic kits, vaccine development, therapeutics, and also now genomic surveillance. So in all the components which we are dealing with, they are playing a major role. So Amrit Grand Challenge, as Sonia has already given a very brief background of this program, has been envisaged as a multi-stakeholder initiative, and that will be now implemented in collaboration with many partners, and we can see the partners here. And this program will identify 75 digital healthcare innovation to promote health technology across the country. And we have Dr. Manish Diwan, who is driving this program from BIRAC, and will now present the key features of the Amrit Grand Challenge, जनCARE Innovation Challenge. Thank you. Over.
Very glad to be here and welcome everybody who has gathered to on the launch of this Amrit Grand Challenge जनCARE program. If we can share the slide deck on the screen, that would be helpful. Thank you very much. Ma'am, with your permission. So we're very glad to announce that Amrit Grand Challenge जनCARE program that is aimed at reimagining the healthcare delivery within potential to touch a billion's life. That gets opened, and the call for application would be open on 26th of January. Under this Grand Challenge, we would identify 75 health innovations from startups, entrepreneurs, including faculty entrepreneurs. The innovations for telemedicine, digital health, mHealth, integrating big data, AI, ML, blockchain, and likewise other technologies. There would be, for these 75 health tech innovators, there would be opportunity for funding, mentoring, scaling up the technology, integrating several partners from states, medtech industries, hospitals, and corporates and investors. So this would bring a lot of people together to facilitate this particular activity. If we look at the next slide, under this initiative, the 75 innovators would be identified under 3 baskets. One for ideation and testing. 60 early stage innovators or innovations would receive a funding up to 10 lakh rupees each. To move from ideation to proof of concept, testing and standardization as per product standards and pilot validation. In the next category, we would be supporting 13 late-stage innovations who would receive a funding support of rupees 20 lakh each for pre-commercialization, pivotal validation studies, and field testing. The last stage, this is the third category, which supports the multi-centric product development. Under this, we would have 2 advanced stage innovations who would receive 50 lakh rupees of funding to support the regulatory approvals, user training, pre and post-market studies, and product launch. So in total, we will have 75 entrepreneurs, startups who would get facilitated. In the next slide, there is emphasis, further clarity given about the area of focus. Primarily, these technical interventions, which would have potential to create a positive impact on the healthcare delivery, would be preferentially supported, which can provide affordability, access, and quality of healthcare services to the country. I will give you some details on this. For example, solutions that can allow access to primary healthcare in tier 2, tier 3 cities, as well as rural settings, such as low-cost, scalable, viable innovations with relevant lifespan, synergy with physical and digital hybrid system for primary healthcare. Solutions that fall under the category to enhance patient compliance, for example, patient tracking systems, patient health record management, patient enrollment system, patient triaging, digital identity, health protection, and health promotion, health education, patient compliance for home care, and entitlement identification of entitlements for the patients. Under health data collection, predictive analysis, digital learning in medicine, some examples include image-based diagnosis, clinical decision support system, smart and connected hospitals, solutions that can help in disaster management, early screening or tertiary prevention, disability delay for patients, solutions that can help in decision support system, self-learning, training solutions, solutions that can help in computation, predictive analysis at both at local as well as global level. Data privacy, storage, and security solutions would also be encouraged. For example, solutions that can involve federated learning models, offline, online, hybrid healthcare model, self-learning management systems, healthcare financing insurance, data integration solutions, exchange of information solutions. Innovations for solutions that can improve community outreach, for example, interventions to facilitate to and through ASHA workers at the last mile level, supply chain technologies, logistics, resource allocation tools, solutions that can provide digital bridge for a connected healthcare. Those solutions which are facilitating data-driven modeling to enable pharma, biopharma research development and innovation would also are also encouraged. Overall, the solutions that are aligned with Ayushman Bharat and National Health Digital Missions will get preference. And I'm glad to tell that the call for applications will be open on a BIREX portal from 26 January 2022. And we can look forward to expected outcome of identification of these 75 innovations by 15th, before 15th of August 2022. You can visit BIREX website for further details. All the partners who are supporting this activity, some representative partners are also here from GCI, NASCOM, and the Incubator Network, IKP. Plus, there would be several partners, as I said in the beginning, medical hospitals, medical medtech companies, investors, states, and government bodies like MIT and other departments and agencies who have come together to support and promote this large activity of Amrit Grand Challenge as जनCARE. Thank you. Back to you, Sonia.
Thank you, Dr. Diwan, for the detailed description of the program. As you mentioned, for the further information regarding this program, I'm requesting the participants to refer to BIREX website, or they can send email to BIREX. So with this, the success of any program depends on harnessing the strengths of the various partners and aligning the goals towards the greater good. So this Amrit Grand Challenge program also brings in the expertise of various partners, as mentioned by Dr. Diwan. To discuss more about this and their involvement in the program, I would like to invite our partners. First of all, Dr. Shashantu Mukherjee, Mission Director, Grand Challenges India. Over to you, sir.
Thank you, Sonia. Most respected Senior Advisor, Department of Biotechnology and MD BIRAC, Dr. Alka Sharma, my colleagues in BIRAC, Dr. Shubhra Manish, and my other colleagues in BIRAC, our partners, Sanjeev and Dipanita. Indeed, it's a pleasure for Grand Challenges India to partner the Amrit जनCARE Grand Challenge. Grand Challenges India is a flagship initiative of Department of Biotechnology and the Bill and Melinda Gates Foundation, as told by our MD. It has been implemented by BIRAC as one of its program management units. Grand Challenges India addresses the unmet need which our country faces in various areas of maternal and child health, data-driven decision-making, and infectious diseases, wash and sanitation, to name a few. And this Amrit Grand Challenges brings a very important element of our initiative is to address digital health, which is very, very critical in these areas of which we are passing through, that is the pandemic. Digital health plays a very, very critical role in delivering healthcare solutions to our country. And Amrit Grand Challenges look forward to address that. As envisaged by my colleague, Dr. Manish, the Amrit Grand Challenges will focus on ideation, then pre-commercialization to multi-sector product development. All these three elements to support 75 innovations play a critical role. And it will also support Tier 2 and Tier 3 cities, which is a strong element of delivering healthcare in our country. And data-driven modeling is one of our key elements to take device decision-making tools, which this Grand Challenges will support. Or also, as emphasized by my colleague, it will support the national missions like the National Health Missions, National Digital Health Mission, and we look forward to work together to find out 75 critical innovations which will go a long way in building these missions to our country. I'm delighted that this is being launched on 16 January, as told by our MD. Honorable Prime Minister has named this as a startup day. So we are proud to be associated with it and look forward to support the Amrit Grand Challenges to bring out 75 excellent innovation in this country, which will not only support the startup innovation ecosystem in this country, but also support the missions of national missions which support, that is the National Health Mission, National Digital Health Mission, which will bring out affordable healthcare interventions in our country. Thank you very much to be a partner of it. Thanks, Sonia. Over.
Thank you very much, sir. So next, I would like to invite Mr. Sanjeev from ASCOM to you.
No, thank you so much to all this team panelists here. Very glad to be part of this initiative, which is a very high impact initiative, and I'd like to congratulate BIRAC for conceiving this and coming up with this initiative. As Dr. Alka Sharma said, this is a multi-stakeholder initiative where we put our expertise together to create an impact, not just bringing out the best of the innovation in the country, but also showing the impact of those things at the ground level. I think that differentiates this innovation program, which is going an extra mile in actually taking it to the second tier and third tier towns, as Dr. Shishendu also said, and we all together strive to make it a big success. And we've already made some inroads, from the other programs that BIRAC has been championing so far. So happy to be part of it, and congratulations once again to the entire team of BIRAC.
Thank you very much for sharing your views, Mr. Sanjeev Malhotra. Now, I would like to invite Mr. Panvita Chattopadhyay for her remarks. Over to you, ma'am.
Thank you, Sonia. A very good afternoon to all of you gathered here for the launch of the जनCARE Amrit Grand Challenge. IKP Knowledge Park, many of you may be knowing, is an incubator headquartered in Hyderabad, and we have incubators in Bangalore, other 4 cities in Karnataka, office in Delhi and Kolkata. And this gives me such a great pleasure to be part of the implementing team. We're the implementation partner of the program. And I thank BIRAC for taking this initiative to really move the digital health initiative that the country needs at this point. I was looking at the number of districts that DPIIT startups are, and I found that 635 districts across India has DPIIT startups, and 36 states and UTs, all of them have at least one DPIIT startup. Can we actually make this a larger number, and through the digital penetration and bring out solutions that, as Dr. Manish Diwan said, impacting 1 billion lives? We would take up this very seriously, reach out to colleges, incubators, and companies, startups, MSMEs, and really see how we can leverage this network that all of our partners bring together to see that solutions are developed for the जनCARE Grand Challenge. Thank you.
So thank you very much, ma'am. With this, we have come to the closure of this session. But before closing this important session, I would like to thank the participants who are also not present and they're listening to us. So we are grateful to the Secretary DBT and Chairperson Rajesh Gokhale for the encouragement and the continuous guidance. Our sincere thanks goes to Dr. Alka Sharma, MD BIRAC, for being the catalyst for this program. A very big thank you to Dr. Manish Diwan for spearheading this initiative. And I also wish to express my gratitude to all partners, Dr. Mukherjee, Mr. Sangotra, Mr. Panvita, for extending their support in this program. I must mention the names of Dr. Shubhra and Dr. Sarma for their ideas and suggestions in the implementation of this initiative. It's a very important program. And last but not least, the BIRAC team for the involvement and continuous hard work. So thank you very much to all of you. With this, I would like to thank all of you for joining this launch ceremony. As mentioned earlier, the program will be live from 26th of January 2022. We request you to refer to the BIRAC website for more details. Thank you.
Thank you, Sonia, and thank you everybody who is gathered here. Thanks very much.
Thank you very much for your devoting
Thank you,
time.
sir.
Thanks a lot. Have a good day.
Thank you.
Thank you. Bye-bye.
Thank you.